Hypoglycemia is a condition characterized by low blood sugar levels, typically defined as a blood glucose concentration below 70 mg dl 3.9 mol/. It is most commonly associated with diabetes, especially when treated with insulin or certain oral medications. Hypoglycemia can also occur in individuals without diabetes due to various other causes. Here is a brief lecture on hypoglycemia. Introduction. Hypoglycemia is an important condition to understand, as it can have significant consequences if not promptly recognized and treated. It is essential for healthcare professionals and individuals at risk to be aware of the symptoms, causes, and appropriate management strategies. Causes of hypoglycemia. 1. Diabetes. People with diabetes, especially type 1 diabetes or advanced type 2 diabetes,